Michael is leading another one. Last time was great, so here we go.
Appreciate that, Erica. Okay, I have a great way to break this down for you. Let us go. An estimated 80,000 veterans live outside the United States. They served this country, earned their benefits, and then moved abroad for family, work, retirement, or just a fresh start. Most of them assume their VA health care stopped at the border. It did not.
The Foreign Medical Program is one of the least known VA benefits in the entire system. It covers treatment for service, connected conditions anywhere in the world, and most eligible veterans have never even heard of it.
I know someone who spent 3 years paying out of pocket for physical therapy in Germany because nobody told him the VA would reimburse it. 3 years of receipts in a shoebox.
The program itself is not new. The legal authority for VA healthcare abroad goes back decades, rooted in the same principle that created the VA system. If you were injured or made ill by your service, the obligation to treat you does not end at a geographic line.
This is VA Benefits 1.48. Today we are covering the Foreign Medical Program from registration to reimbursement. And stick around for the filing deadline that catches more veterans than any other rule in this program. Let me introduce the team real quick.
Good to be in the co-host seat for a change. Let us have some fun with this.
River here. The bigger picture on this is what got me excited.
Hello, I'm Lewis. There is more going on here than most people realize.
Great team. Let us get into it.
The eligibility rule is straightforward, but the details matter. FMP covers medical services for any VA-rated service, connected disability. That means an illness or injury that was caused by or made worse during your military service. If the VA already rated you for it, FMP covers treatment for it abroad.
And it goes one step further. FMP also covers conditions that aggravate a service-connected disability. So if you have a rated knee injury and you develop a hip condition because of how you compensate for that knee, FMP can cover the hip treatment too.
Think of it like an insurance policy that follows the injury, not the address. Your service-connected conditions are covered whether you live in Texas, Tokyo, or Toulouse.
Here is where it gets real for people. A veteran living in Costa Rica with a 30% rating for a back injury does not need to fly back to the States every time that back flares up. They walk into a local clinic, get treated, and file for reimbursement.
One thing that surprises most people, you do not need to be enrolled in VA healthcare to use FMP. Those are two separate systems.
That distinction matters because many veterans who moved abroad years ago never enrolled in VA healthcare. They assumed that door was closed. Erica, tell them it is not.
It is not. FMP registration is independent. If you have a service-connected rating, you can register regardless of whether you ever used a VA hospital.
So you qualify. Now what? The first step is registration, and this is where a lot of veterans stall because they assume it is complicated.
Think of registration like getting your passport stamped before a trip. One form, once, and then the program is open to you. The form is VA Form 10-7959F-1. You can fill it out online, print and mail it, or fax it.
Once VA processes your registration, you receive an FMP authorization letter. That letter is your proof of coverage. Some providers abroad will want to see it before they treat you, so keep a copy with you.
Here is something the registration process does not tell you up front. You can choose any licensed healthcare provider in the country where you live or travel. No network restriction, no referral requirement.
That is a massive difference from stateside VA, where you are assigned to a specific facility or community care network. With FMP River, The entire licensed medical system of whatever country you are in becomes your network.
One practical tip from someone who hears these stories. If you can choose a provider who keeps records in English, VA will translate foreign language documents, but translation adds weeks to your claim processing time.
Registration gets you in the door. Filing claims is how you actually get paid. And this is where the process either works smoothly or falls apart, depending on whether you know the rules.
Picture it like filing an expense report after a business trip. You got treated, you have the receipt. Now you submit the paperwork. The form is VA Form 10-7959F-2. You can file online through va.gov, by mail, or by fax.
Here is the deadline that catches veterans off guard. You have exactly 2 years from the date you received care to file your claim. Miss that window and the claim is gone. No exceptions. A 2020 5GAO report found that delayed reimbursements were one of the biggest complaints from veterans using the program.
2 years sounds generous until you realize how fast it goes when you are living abroad and dealing with foreign health systems. That veteran I mentioned in Germany with the shoe box of receipts. The older receipts were past the deadline, gone.
There are 2 ways the money flows. Option 1, your provider files the claim on your behalf and VA pays the provider directly. Option 2, you pay out of pocket, file the claim yourself, and VA reimburses you.
You need an itemized billing statement, proof of payment, if you already paid, and supporting medical documentation. Lewis, wait until they hear the emergency care timeline. It is much tighter than 2 years.
Emergency care abroad has its own rules, and the timeline is much shorter. If you go to an emergency room for a service, connected condition while overseas, you must notify VA within 72 hours. That is not 2 years, that is 3 days.
Imagine you are in Thailand and your service, connected heart condition sends you to the ER at 2 in the morning. Your first call after the doctor stabilize you needs to be to FMP. 72 hours.
Now here is something most veterans do not know. There is exactly one VA healthcare facility outside the United States. The Manila VA Outpatient Clinic in the Philippines, located on the U.S. Embassy compound.
That is a critical point, Michael. The Manila Clinic can treat service-connected conditions directly, like a stateside VA facility. But FMP covers you everywhere else in the Philippines and everywhere else in the world.
Now for the limitation that catches the most veterans off guard. FMP only covers service, connected conditions and conditions that aggravate them. If you have a 50% rating for your back, but you catch the flu in Portugal, FMP does not cover the flu. That is non-service, connected.
That gap is real. Veterans abroad often have no other health coverage for non-service connected conditions. Some countries offer national health systems. Others do not.
If you forget everything else from today, remember this. FMP is powerful, but it is not comprehensive health insurance. Plan for the gap.
Let us bring it together. FMP covers service, connected conditions and aggravating conditions for veterans living or traveling abroad. Any licensed provider, any country, no referral required.
Register with VA, Form 10-7959F-1. File claims on Form F-2. 2 deadlines to remember. 2 years for standard claims. 72 hours for emergency notification.
And remember Michael's point about the Manila Clinic. If you are in the Philippines, register for both. Everywhere else in the world, FMP is your lifeline for service-connected care.
If you have questions about your specific situation, call the FMP line at 877-345-8179. Real people who handle this every day.
Drop in the comments if you are a veteran living abroad or thinking about it. What country are you in and have you used FMP? Your experience could help another veteran figure out this program.
Next video, we cover the MOVI program, free weight loss support, dietary counseling, and even bariatric surgery through the VA. That is VA Benefits 1.49.
If this series is helping you understand benefits you have earned, subscribe. We are covering every major VA program so nothing gets left on the table.
Always verify everything with va.gov or an accredited Veterans Service Organization. Now let us see what you remember.
Okay, it is quiz time. Let's find out what stuck. Think through each question carefully before you answer.
Drop a like if we earned it, and subscribe so you never miss the next episode.
A veteran with a 40% VA rating for a service-connected shoulder injury moves to Spain. They need physical therapy for the shoulder at a local clinic. Which statement about the foreign medical program is correct? The correct answer is D. FMP will reimburse the physical therapy because it is treatment for a VA-rated service-connected disability, and the veteran can choose any licensed provider.
A veteran registered with FMP receives treatment for a service-connected condition at a clinic in Japan in January 2024. They forget to file a claim. What is the latest they can submit the reimbursement claim? The correct answer is C, January 2026, because FMP claims must be filed within 2 years from the date care was received.
A veteran living in Thailand goes to an emergency room for a service-connected heart condition. After being stabilized, what is the most critical step they must take to ensure FMP covers the visit? The correct answer is B. Notify VA within 72 hours of receiving the emergency care. Lewis here. The piece that matters most is the eligibility clarity. Service, connected conditions and aggravating conditions covered worldwide. No VA. Enrollment required. No provider network. No referral.
River jumping in. The human side of this is what sticks with me. Veterans abroad often feel cut off from the system they earned access to. FMP is the bridge. It is not perfect. The GO report made that clear, but it exists and most eligible veterans are not using it.
2 forms, 2 deadlines. Form 10-7959F-1 to register. Form F-2 to file claims. 2 years for standard claims, 72 hours for emergency notification.
And remember the limitation. FMP is not comprehensive health insurance. It covers what the VA rated you for and conditions connected to it. Plan for the gap. Next video, we cover the MOVI program, free weight management, dietary counseling, and even bariatric surgery options through the VA. That is VA Benefits 1.49. If this series is helping you claim benefits you have earned, subscribe. We are covering every major VA program, so nothing gets left on the table. Think in pictures, and the answers follow.
Well done, Michael. I might let you do this more often. Professor Erica signing off.